Your month's postpartum. Your baby's growing fast. Your doctor has cleared you. But your belly still looks pregnant. It's frustrating, and you might wonder if you're doing something wrong. You are not. This shape isn't failure, it's physiology. Today, we'll talk about what's actually going on, whether you had a vaginal birth or a C-section, and what helps your core heal safely. Hi, I'm Cherry, a certified maternal and newborn nurse with over 25 years of bedside recovery experience. If you're a first-time working mom juggling healing, feeding, and a never-ending to-do list, this video is for you. So, before we start, get access to my free resource hub for career moms below. It includes my free postpartum nutrition and movement quick start. It's a simple one-page guide that shows you how to fuel, move, and rest in ways that actually support healing, not exhaustion. The link is below. So let's start with what's really happening in your body. During pregnancy, your uterus expands up to 500 times its original size, pushing the abdominal wall outward and stretching the linea alba, that thin connective tissue between your six-pack muscles. Research summarized by AWHONN shows that almost every pregnant woman develops some abdominal separation, called diastasis recti, in the third trimester. After birth, that gap narrows slowly, but true connective tissue recovery takes 6 months to a year. After a vaginal birth, you may notice a soft pooch. That's from lingering uterine involution. Your uterus still shrinking back to size, combined with muscle lengthening and the way your organs are shifting downward. After a C-section, you add surgical healing to the mix. Scar tissue forms across multiple layers, sometimes causing tightness above the incision and pouching below it as those deeper layers heal unevenly. The result of all this stretching, swelling, and reduced muscle tone is that familiar rounded belly. Now, about the timeline. In the first 6 weeks, your uterus shrinks dramatically. Pain, hormones, and fatigue inhibit your muscles, and your only job is mobility and breath. Between 6 and 12 weeks, once you're cleared, ACOG recommends easing back into activity. Collagen in your fascia is still immature, so this phase is all about gentle activation, not flattening. Around 3 to 6 months, fascia begins to strengthen, but stress and sleep loss can slow progress. Good nutrition and posture awareness start to pay off here. Between 6 and 12 months, most moms notice their waistline firming as the deep muscles re-engage. If the bulge remains, it may be from diastasis recti that needs a pelvic floor physical therapist guidance. Hormones play a huge role too. Relaxin and progesterone, which loosen connective tissue during pregnancy, can linger for up to 5 months postpartum, especially while breastfeeding. That means your fascia is still flexible and slower to tighten. Healing is both hormonal and muscular, and patience is part of the plan. So, what can you do right now? Begin with your breath. Inhale through your nose, let your ribs expand sideways, then exhale slowly and draw your belly in towards your spine. This reconnects your transverse abdominis, the natural corset that flattens your abdomen from within. Check your posture throughout the day. Sit tall with your ribs stacked over your hips and shoulders relaxed. Small alignment fixes make a big difference. Movement matters too. Gentle walking for 20 to 30 minutes a day improves circulation and collagen repair. It's your foundation before any formal workout. Avoid planks or twisting until you can breathe evenly without your belly doming. Nutrition supports everything. ACOG recommends around 1.1 grams of protein per kilogram of body weight daily if you're breastfeeding. Combine that with vitamin C rich foods, complex carbs, and hydration. This is not about dieting, it's about fueling healing. For C-section scars, once your doctor clears you, usually 6 to 8 weeks, gentle fingertip massage along the incision can help prevent tightness. If it hurts, stop. If you'd like these steps organized in one place, get access to my free resource hub for career moms. It includes a postpartum nutrition and movement quick start, which has my plate builder, snack ideas, and 2 10-minute workouts you can do at home for free. Practical and designed for working moms like you. So when should you ask for help? If you notice a gap wider than 2 fingers at your midline, bulging when you sit up, pelvic heaviness, pain, or leakage, talk to your provider or a pelvic floor therapist. Early assessment shortens recovery and prevent long-term back or pelvic issues. Many moms tell me this belly makes them feel like they're still in the waiting room of recovery. I want to remind you, your body didn't fail you. It built and nourished life. Healing is not cosmetic. It's structural and hormonal. Progress is measured by comfort and strength, not your pants size. That lingering belly isn't a stubborn fat. It's your fascia and core asking for more time, fuel, and care. Support it. Move with patience and you'll see a change month by month. To build directly on what we talked about today and show you exactly how to move forward safely, watch this video next. Before you go, I want to leave you with this. Your recovery isn't meant to be fast or linear. Healing after birth takes time, intention, and compassion. Give yourself permission to move slowly and celebrate the progress only you can feel. Every deep breath, every mindful step, and every night you choose rest is proof that your body is doing its job. If this video helped make your recovery feel clearer and calmer, please like and subscribe. It's the simplest way to tell YouTube to keep showing you nurse-backed postpartum guidance that respects your body and your time. You deserve recovery that feels informed, realistic, and supported. I'm Cherry, and I will see you in the next one.